Good. Good. All along the top of the foot. Any differences in sensation between the two sides? Good. All right, Sandra. Are you comfortable in the position that you are in? Very good. Okay. Class, can everyone see everything appropriately? Okay. Now I realize you guys don't have a great plantar view. I will do my best to describe things to you as I see. Okay? So beginning with our examination, I am going to go ahead and assess Sandra's footwear. Now, she tells me that she wears these shoes almost daily. These are her most comfortable pair of shoes. Now, during my clinical experience, I like to advise my patients to bring shoes that they wear rather frequently. You don't want your patient to bring shoes that they think is their ideal shoe or shoes that they only wear occasionally. We want to see the shoe that they are wearing on a daily basis. So for Sandra, that would be this. Now, these are a slip-on sneaker. So starting by assessing the sole of the shoe, I do see some wear here at the midpoint where most of the weight is put on the ball of the foot. So I'm just going to check for any asymmetry between the two here, and I do see a very slight difference. Now it looks like Sandra tends to lean more towards her right side, which would make sense because she is right hand dominant. So looking at the rest of the shoe, I'm not seeing any abnormal wasting of the heel. I don't see any, I do see maybe some slight wasting here at the back right side. So it does appear as if Sandra leans to the right outer portion of her foot. Now, as we flip the shoes over, they are obviously very well worn. I do see the heel of her shoe exposed here. So this is something that I would say is concerning to me because our patient is diabetic and obviously foot health is very important. So this concerns me solely because her foot is rubbing up against the rougher part of the shoe, which could cause some damage to the heel of her foot. So that is something that we will be assessing. Otherwise, I don't notice any abnormalities in wear of the shoe. They are fairly equal symmetrically. Okay, so a recommendation I would make to a diabetic patient is preferably closed-toed as well as closed-heeled shoes as they tend to be the most protective of the feet. Okay? All right, so Sandra, I'm going to begin with your lower extremity assessment. Now, normally, typically, I would have patients change into a hospital gown. Obviously, Sandra is a volunteer today, so I will not ask her to do that. I will, however, ask if it's okay if I just expose the leg. Okay, so I am going to just roll up her pants. Luckily, Sandra is wearing pants that are fairly malleable. So, in a typical clinical setting, I would expose the leg up to the knee. For the purposes of the demonstration, I'm going to go about mid-calf, and of course we will remove the socks. So I'm going to take off Sandra's socks. Good. Now the first thing I'm going to do is perform a test for any temperature abnormalities. The reason I like to perform this test initially is because any manipulation or palpation that we do manually can affect the temperature of the patient's feet. The more you start moving around and manipulating, your body heat can transfer. So I am going to begin by gently applying pressure with my fingertips here to Sandra's legs and coming down the foot, testing for any variation in temperature as we come towards the toe, feeling for any coldness or lack of circulation at the toe, which is very mildly notable for Sandra. I'm not noticing any drastic variation in temperature, and they do feel relatively similar in temperature throughout. Sandra, do you find that you typically have colder toes than the rest of your body? So if your patient is verbalizing that they tend to have colder feet, colder toes, that is something that we might want to look into further. Now, the second thing I'm going to do is just do a basic visual inspection. So I'm going to have a look at Sandra's feet and legs as a whole. So starting at the legs, I'm looking for normal hair growth pattern, any issues at the follicle, any signs of folliculitis or rash, any hives or discoloration of the skin, of course, any abnormal bruising. Then having a look at the feet. So dorsal side of the foot is clear. I do notice some slight freckling here and there, which is well within normal limits. So moving on to the inspection of the toes, I am going to have a look, of course, between all of Sandra's toes. This is a very important aspect of the diabetic foot inspection, as we want to ensure there are no signs of unseen fungal infection or any ulcers. Diabetic foot ulcers can hide in between the toes. So not present here today. Another really important place to look for ulcers is at the ankle. And I am also not notating that here. So I'm going to test for capillary refill, which is again a test for circulation. Okay, so can anyone tell me what the normal amount of time is for return of blood flow? Yes, that is correct. Very good. So we are testing for that. You should see a flash of white followed by a pinkening response, which is the blood returning as normal. So typically we would test this at the toenail. Obviously most female patients have their toes painted, so you can either test at the very tip of the toe or just beneath at the fatty portion of the fat pad down here. Okay, all of that is appropriate. I also like to stretch upward at the toe and look for a natural whitening and then return of blood flow underneath there, which is present as well for Sandra. So moving on to our palpatory assessment, I am going to feel around with a bit of a firmer palpation. Sandra, if you feel any pain or discomfort here at the leg or foot, please do let me know. I am simply manipulating around the joints, feeling for any abnormal nodules, any lumps or bumps that should not be there. So feeling both interior and anterior joint here. I'm going to do a bit of jostling and manipulation at the ankle. Good. And a bit of compression at the foot as well, feeling for any signs of rigidity here. Very good. Now, our patient today is not complaining of any pain. Obviously, if your patient in clinical practice was complaining of pain, you would be far more delicate and try to do some pain isolation. Okay? So Sandra, I'm going to do some testing of your lower extremity mobility here. So just relax the weight of your leg in my hand. I am going to move around at the ankle. Okay, so I am noting some slight rigidity here. Not quite as much on this side. I'm going to have you bring your feet up towards you. So pull your top of your feet towards you. Good. And push down towards me. Very good. So we are seeing a little bit of tightness here at the top of the ankle. I would like to see some slightly more mobility here. So it does appear as if our patient could do with some stretching and possibly some dynamic stretching to loosen some of the tendons here at the foot. Okay. So moving on to our visual inspection of the skin itself. Now, just going to look over once again, doing a bit of a closer inspection at the toe. Again, looking for any hidden ulcers or lesions, any open areas of skin, particularly on the plantar region of the foot. Also feeling for any areas of abnormal callus, which is not notable. Okay. No signs of a fungal infection and no abnormal openings anywhere. So that is all good. Going to have a look directly at the toenails. Now Sandra's feet are very well groomed. It is very important for diabetic patients, both type 1 and type 2, to take adequate care of their feet, not just for aesthetic purposes, but for the overall health and wellness of their feet. Okay, so testing some mobility here at the toes. Sandra, I'm going to have you scrunch your toes as tight as you can. Good, and stretch as wide as you can. Very good. Okay. All right, so no issues with that. I am going to go ahead and move on. Now, I'm going to use my reflex hammer to test for mobility at the ankle, testing for reflexes at the ankle, excuse me. So, of course, looking for movement at the big toe. Now, ideally, you would test this with your patient sitting, but you can test with your patient lying as long as you see that movement there. Now, testing interior here. Good. Good. And then, of course, at the first digit there, which is intact. Now, I am going to use my tool here to test for any signs of fluid buildup or edema of the lower extremity, which I do find quite frequently in both my type 1 and type 2 diabetic patients. And the reason for that is that abnormal insulin resistance can cause fluid buildup, specifically of the lower extremity. So just using this to test for any abnormal pockets of fluid. This will allow me to look for both pitted and non-pitted edema, none of which is notable. I am seeing good return, normal skin turgor. And our patient is not describing any pain as we perform this examination, which is a good indication as well. So following that down the dorsal portion of the foot, we are going to come between the first two digits here. Good. Going to test over the fatty portion of the foot here, feeling for any abnormal callus, which would be notable with some signs of rigidity, and I am not notating that here. Now, moving on to our test of Babinski reflex, I am going to test that a couple different ways here. Now, I do tend to perform extended Babinski reflex testing for my diabetic patients specifically. So, Sandra, I apologize. This test can be mildly uncomfortable or ticklish. I am going to bring an object across the bottom of your foot, and this is testing for a very basic neurological response. Okay, so I'm going to start with my softer object, which can sometimes be harder to differentiate here. So, starting at the heel. Okay, so little to no response there. So we are going to move up towards the sharper end of our Q-tip here. So again, did see a mild response here at the toe. And on this side as well. So we are going to now test that with a rather cold object. And Very good response to Babinski here. Slightly delayed response here. Okay. Now lastly, we're going to test with our sharpest object, and this is our Wartenberg wheel. Now we don't want to apply so much pressure that we are creating an indent on the skin. This is simply testing for that natural reaction here. So very gently across the skin, okay? Very good response there. Very good response there. Okay, so Sandra's Babinski reaction is well intact. All right, Sandra, so for the last portion of your lower extremity examination, I am going to test for neurological response. Now, this is a very important aspect of the diabetic foot inspection, okay? So I want everyone to pay attention here. I am going to begin with our lightest object, Sandra. Now, again, just as we tested at the upper extremity, you are going to say yes or just nod your head if and when you feel something, okay? So again, class, we are testing for a varied response. I do sometimes ask my patient, for example, Sandra, can you feel this? Can you feel this? Can you feel this? And this? Can you feel this? Good. 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 Can you feel this? And this. Very good. Now I am going to use our sharp tool here. So you are going to feel a soft prick. Again, indicate whether or not you feel it. Good. 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 Can you feel this? Good. And can you feel this? And good. Can you feel this? Can you feel this? Good. 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 Very good. Okay. Now, moving on to our Wartenberg wheel. Sandra, this time I would like you to indicate to me whether or not this feels the same or different on either side. So now we are testing for bilateral sensation response. So ideally your patient would feel the same exact thing on both sides. If there is a variation, then we would want to retest. Okay? So Sandra, can you please tell me if this and this feels the same or different? Good. And all along the top of the foot. Any differences in sensation between the two sides? Good. And here. And here. Good. And if I test at the ankle. Good. And across the toes. Any difference here? Good. This might be slightly ticklish. Any difference here versus here? Here versus here? And lastly, here and here. Good. Very good. So Sandra has indicated that all of that feels the same. Now, following up very similar, you're going to feel a soft brush. This is just a surgical sponge. I like to test using both sides for a varied soft response. Can you tell me, Sandra, if this feels the same or different than this? A correct response would be that it feels different in that I used a different side of the sponge. Okay? Any difference here versus here? And lastly, does this feel about the same as this? Very good. So our patient has indicated that there is no difference in bilateral sensation. So overall, I would say Sandra's foot health is intact. The only variables that I noticed were some very mild circulatory dysfunction in the coldness of the toes, nothing that I would say is particularly concerning, although it is notable. So I will document that in her chart. Otherwise, her sensory components and her reflexes were intact. So I am going to go ahead and place Sandra's socks back on. Now, I will be asking her to leave her shoes off for now, as I am going to do a brief gait assessment prior to her leaving the office today. So let's go ahead and assist her with her socks. Now, Sandra, I am going to come around the table and have you stand, and I will have you perform a couple tests for mobility as well as gait function, okay? All right. All right, Sandra, now if I could have you just take a couple steps in place for me. So I'm going to have you just march in place. Perfect. Now if I can have you turn to your left and walk towards that wall for me. Just walk with your normal gait. Normal stance. Good. Now if you can turn and come back the opposite direction, this time I'd like you to walk heel to heel. Very good. Perfect. Now if you can return to your original position for me, I'd like you to stand on your tippy toes just briefly. Any difficulty there? Very good. Now if you can stand on your heels, so toes off the ground. Very good. And lastly, if I can have you drag your foot down the front of your shin. And repeat the same on the opposite side. Very good. So you can go ahead and have a seat on the table, and class, that will conclude our examination for today. Please document and take notes accordingly.